speaking just a little bit more on reducing dysfunctional breathing and changing breathing habits, the first step is always to help the patient become aware of their breathing pattern. Most people have never really been asked to really spend some time just experiencing and feeling what their breathing is like in many different ways. And we go through all those many different ways in therapy so that patients can become aware of their incorrect breathing habits. And when it is correct, there are things that they're doing that are probably just fine, and they need to know that too so they don't get rid of the good. But primarily with this kind of approach that I use, it's a lot of nasal breathing. Nasal breathing actually allows the breath to be a bit slower and longer, and so it helps to build up the CO2. And it's using these smaller breaths because they're nasal. They're also smaller breaths, and the breathing is calmer and it's slower, and it's also predominantly diaphragmatic breathing, lower rib cage breathing, and at some point when you're going at a certain speed or for a certain length of time, of course, there's also going to be some upper chest motion because it's normal that will happen. But there's so many patients I see, and maybe you see them as well too, where they're only doing chest breathing or clavicular breathing, and they're not using the diaphragm at all. And that, as we know that is the primary muscle for respiration. And a lot of patients just aren't using it. And also, if a lot of patients are mouth breathing, that tends to be easier to fall into chest breathing. Nasal breathing seems to be easier to go then down into diaphragmatic breathing. Hey, thanks for sticking around to the end of the video. If you found the video helpful and you'd like to learn more about the techniques and also be affiliated with other speech pathologists who treat EILO using a holistic approach, then the next step for you would be to take my online Level 1 P.I.E Approach course. And after you take the course, you have access to the P.I.E Approach community, which is a collective group of SLPs who you can connect with and get support from. And also you get access to my free monthly Zoom Q&A calls where you can talk about a case maybe you're having trouble with, or you can share a win, or you can just sit back and listen to the discussion. You also get access to archived Q&A sessions from past recordings, and you get a lot more too. So if this is something that you think you'd be interested in, then read the description below, and you can click on where it says PIEapproach.com.